As doctors, patient safety and well-being is your #1 priority. But when patients come in for pain management, you have an extra challenge. They may be scared, uncomfortable, or even angry. They want to see that you understand that they're in real pain, and they want to hear real solutions. Prescribing opioids is one option of managing a patient's pain, but it's not always the best choice. So, what is the best way to talk to patients who are expecting an opioid solution? Let's look at 2 conversations.
Hey, Doc. I was hoping to get something for my back. I tweaked it moving into this new apartment, and I could barely get out of bed the last couple days.
Okay, since you're in a lot of pain, we're going to start you with some anti-inflammatory medication.
Anti-inflammatory? What about opioids? I hear they really work.
Well, opioids are powerful medications for acute pain, like after surgery or for broken bones, but they're only meant to be short-term solutions. They don't actually fix whatever's causing your pain. So after this, we really want to try the basics. A non-addictive medication like an anti-inflammatory, and hot and cold packs.
But what if the pain doesn't go away?
If the pain doesn't get any better, we can start looking into other solutions, things like physical therapy. That can actually heal your pain and prevent your injury from getting worse in the future.
Okay, let's try it.
So, I see that you are requesting a higher dose on your prescription. Is that correct?
Yeah, my knee just keeps getting worse.
Okay, let's work together to find the right long-term solution. Now, we've used opioids to help you control your pain so far, but since we're not seeing any improvement, I think we need to start talking about other options. Have you tried the physical therapy we talked about before?
I tried one time and it hurt.
At this point, just refilling your prescription might be dangerous since opioids become more addictive and less effective over time.
Wait, so you think I'm an addict? You don't get it. I can't work, I can't sleep. The pills barely even help.
Our goal is to help you get better safely, and opioids aren't appropriate for long-term pain management. Let me explain how tapering opioids works, and we'll see how you feel about it, okay?
Okay, let's hear it.
Well, many patients who taper off opioids find they're able to control their pain more effectively afterward. And I know you want a long-term solution, right?
Right.
So I'm going to recommend reducing your dosage bit by bit while we begin other types of pain management. At first, you may feel some bad effects like nausea, headaches, and a little more pain than you're used to. But over time, we hope to get your pain to a manageable level.
What if something goes wrong?
That's what I'm here for.
You know, I don't like it, but if that's really the best option, I'll trust you. Let's do it.
Talking about opioid safety can be hard, and pain rarely makes our patients more reasonable. But when we remember to react clearly and compassionately, we ensure that every patient gets the attention they deserve.